All right. I know folks are still filtering in, but I want to make sure we reserve as much time as possible for this great presentation and to get to your questions. So thank you to those who submitted those in advance. My name is Alex Huffman. I'm the Director of Supportive Care and Integrative Oncology at the Cancer Center. I've been your host for this Lunch and Learn series since we started, and really good to see many of you returning today, and welcome to those joining us for the first time. Just so you know, this is recorded, so we are in webinar feature and we can't see you and your faces, but we can see you in the chat. So if you do have questions throughout the presentation, go ahead and put those in the chat and we will build in time to answer those in the end. This is meant to be a general education session. So Dr. Fediw and his team will not be able to get into specific medical advice. However, we do encourage you to go back to your treatment team if you have those questions, and sounds like you might need to get an appointment from what you're hearing today. So let's go ahead and get started with introductions. We have a great team of 3 here today from our physical medicine and rehab group to present this topic of lymphedema in cancer, tips to avoid it and to manage it. With us today is Maddie Mills. She is a certified lymphedema therapist and a certified wound care specialist. As an occupational therapist, she has worked in a variety of settings, including the acute care, inpatient rehab, and outpatient therapy settings. She's also completed the advanced lymphedema therapist training through the Academy of Lymphatic Studies. We also have Lina Asfoor. She is a certified lymphedema specialist as well and has completed a cancer rehabilitation specialty through Select Medical's Revital program and a plastic surgery therapy certification through the Academy of Lymphatic Studies. As an occupational therapist, she has worked in a variety of settings as well, including the ICU, acute care, inpatient rehab, and school setting before finding her niche in the outpatient setting here. And last but not least, Dr. Michael Fediw is an assistant professor in the Department of Physical Medicine and Rehabilitation at UT Southwestern's Medical Center and the medical director of its Cancer Rehabilitation Program. Dr. Fediw serves on several institutional committees, including UT Southwestern's Commission on Cancer, the Simmons Cancer Center Survivorship Committee, and the National Accreditation Program for Breast Cancer Centers. He's also a UT Southwestern representative and panel member for the National Comprehensive Cancer Network Cancer-Related Fatigue Guidelines. So team, thank you so much today. I'm going to turn it over to you to get through this awesome presentation.
Thanks, Alex. Hi, everyone. Like was mentioned, I'm Dr. Fediw. I've been here at UT Southwestern for almost 6 years now, and I've been building a cancer rehab program, a part of which involves our kind of comprehensive lymphedema program. So we're going to talk a little bit more about that today. So we're going to talk about some pretty broad topics of what is lymphedema, what is not lymphedema, how can you kind of avoid it, how should you manage it, and how do we treat it, and when should you seek care, okay? And how us at UT Southwestern are also trying our best to stay on top of it and also make sure it doesn't become bigger problems or problems at all. So I'll get started. So one thing I always like to tell people is, edema is just a medical term for swelling. So when you hear words like edema, it just means something is swollen. However, not all swelling is created equal, and not all swelling comes from the same place. I would say that most swelling is not lymphedema that we see. However, in cancer patients, lymphedema tends to be more prevalent. It's the #1 cause of lymphedema, at least secondary lymphedema in developed countries, at least. And it's very common and more prevalent in the cancer population, which is why you all here are hearing about it. So, but I always like to make that distinction because just having cancer and swelling doesn't mean it's lymphedema. And you can have sometimes mixed causes. So it does have distinct features to it, and it has a unique treatment to it that is different, which is very important because to adequately manage it, you kind of have to manage it as lymphedema and not like other types of swelling. So I wouldn't get too worried about the kind of busyness of this slide, but I'm a visual person, so I like pictures. But basically, your lymphatic system, which lymphedema comes from your lymphatic system, is an open system of basically blood vessels, but they don't have blood in them. They have what's called lymph in them that run along some of your other blood vessels kind of in the linings of the body. So kind of just underneath the skin, but also along the linings of some of your organs, intestines, things like that. And it's a very low pressure system. I always like to kind of mention that it's not connected directly to your heart. So when you have your heart pumps and it pumps blood. Blood goes into your arteries, it gets collected in your veins, returns back to your heart. It's kind of a pump system. Your lymphatic system is different. It doesn't have a pump that pushes the fluid through. So if there's blockage in that system, you have to guide it. So it's very low pressure, it's very low flow. Think kind of like a lazy river kind of moves. It contracts almost like your gut does, almost like a snake, where it's this very slow, steady contraction that kind of gradually kind of pushes and guides that fluid along. And understanding this is important about when it comes into later on, how do you treat lymphedema and why do we treat it this way? So lymphatic vessels can be damaged for a variety of reasons. In the cancer population, it's often related to either cancer growing in the lymphatic channels or either the treatment of cancer, like things like radiation, things like surgery, can also cause damage to your lymphatics. So your lymphatics drain different parts of the body. So there's these kind of groups of lymph nodes. Most people have heard of a lymph node. When you get a cold and the glands in your neck swell up, that's your lymph nodes trying to fight off an infection for you. So different areas of your body have different groups of lymph nodes, and they kind of drain specific parts of the body. The reason why this is important is because, so for instance, if you've had breast cancer and on one side and you have lymph nodes taken out of, your armpit area, that swelling is only from the area that drains. It doesn't, if you get swelling later on in the foot on the other side of the body, that's not necessarily a related thing. Because like I said, the way your body drains is not the same. So it tends to drain these different regions. So that's why it's always important to pay attention to different types of swelling, because sometimes people just say, oh, well, I have lymphedema here, it must be there. And like I said, some of you have different stuff going on that needs kind of its own workup and treatment. What does lymphatic function do in the first place? So one of the things it primarily does is it's part of your body's defense mechanism. So your lymph nodes are an immune part of your body that helps your body sense things that are foreign, like bacteria or viruses and things like that, and recognize them and create an immune response to them so your body can fight whatever that is off. The other thing is your lymphatics, they have a really high fat and protein content in them. So lymphatic fluid is actually kind of like milky. And this is also important to know because it's part of that causes some of the complications we see in lymphedema. So the different characteristics of the lymphatic fluid compared to swelling from other types that tend to come more for your blood vessels or things like that, give it some of its unique properties, but also kind of trigger some of the worsening over time. That high fat, high protein tends to cause this really low-grade inflammatory response, which isn't like, it's red, it's hot or anything like that, but it's enough that it triggers kind of this fibrosis to set in, and it kind of turns into this almost fatty scar tissue. And that's if you don't treat it over time, it will kind of drive that process. And we'll kind of talk about a little bit about the progression of lymphedema if you ignore it. So different things can increase your risk. So one is obesity. So if you are a higher body weight, that does tend to put you at a little bit higher risk of developing lymphedema. Certain types of chronic inflammation and like autoimmune diseases like rheumatoid arthritis can also contribute. What type of treatment you had. So if you've had lymph nodes removed from your body, that's obviously going to put you at higher risk. If you have more lymph nodes removed from your body, that's going to be higher risk than if you have less. Radiation is also a known risk factor. Certain genetic conditions and also things like infections can also cause lymphedema. Sometimes having other types of swelling that aren't treated can also contribute to developing a lymphatic kind of dysfunction over time, but usually that's not as seen as much in cancer. So I always like to remind people as well that unfortunately, I wish I was wrong in this, but lymphedema is a chronic condition, except in very, very specific circumstances once you have it, you have it. So it's really important to note that, because when you're thinking about the long-term management, you kind of got to stay on top of it. And the earlier you do it and the more consistent you are, the way easier and less inconvenient in your life this is going to be. So I wish I had cooler answers than that, but a lot of people want to just come in and just make it go away and cure it. So we can reduce it, and sometimes we can just make it look very minimal where it's, not there, but you always have to stay on top of it. And we don't have currently any cures for it. Even surgery's not a cure. So the way you manage it, you have to continue to manage that over time, even if you're adding in other treatments, even like surgeries. So I'm very clear about that, because ultimately when I see patients, I want them to have a good outcome. And I also don't want to put false carrots in front of people of what to expect and what not to expect. But the earlier you recognize it and the more consistently you treat it, the more easy it is to manage. But I also want to reiterate that if you leave it ignored and you don't do anything about it, it does have a tendency to progress over time. It's not something that happens overnight, but it does kind of get worse. And what happens is when that fatty scar tissue that I kind of mentioned earlier sets in, you can move the fluid, but you can't really move that fatty scar tissue. So that it kind of causes new problems, and that's when it kind of gets a little bit worse. And you can't necessarily get it back down to its original size once you're kind of through some of those gates, if you will. So we take it very seriously because we want it to be as less of a problem in your life as we can. So I've seen kind of a gamut of things, and sometimes, I said, I understand when people want it to be less of a problem, but if you ignore it, what I don't want to see is I don't want to see you later on down the road with a worse problem. Okay, so a couple quick pearls, and then we'll get into some of the kind of more treatment side of things. So one thing that we always hear is, the internet is full of information, good and bad. A lot of people are told that you cannot get blood drawn from an at-risk limb. So if you've had a mastectomy or something, you can't get blood drawn out of that arm. So that's actually not been really found in research to be correct. We don't really have, and they've done studies where they've looked at this to see if this is an actual thing, and it's not really something that you see in the real world. Common sense would say if you have an at-risk limb and a non-at-risk limb, use the one that's not at risk. However, sometimes over time, especially if you're getting a lot of blood draws, people's arms can kind of take a beating, and if you need to get blood drawn to the other side, it's generally okay. It does increase your risk of infection a little bit, which hypothetically could contribute to more lymphatic dysfunction, but in general, we don't have any evidence to suggest that that's a problem. Same with blood pressure cuffs. So you can get blood drawn in that arm. You're not going to develop lymphedema just because somebody put a blood pressure cuff on that arm. Same thing if you have a not at-risk limb. Common sense said use that one, but if you need to use it on the other side, it's fine. You can fly with lymphedema. We usually recommend that you wear a lymphedema sleeve when you do that if you're at risk because of the pressures in the compartments of planes. But back in the old days, you used to tell people, now that you have this, you can't fly, and that's just not true. You can exercise with lymphedema, and you should exercise with lymphedema because it's actually part of the treatment. Some older ideologies have still prevailed, less commonly now than they used to, but they used to tell people don't really exercise, don't really use that limb, and that's just not true. If anything, it actually helps. Diuretics, so these are things like, you might hear terms like Lasix, other things, don't really tend to help with lymphatic swelling. Early on, they might a little bit, but over time they don't. So, a common response is they go see your primary care doctor, like, oh, let's try a diuretic to help you kind of pee some of this fluid out. Lymphatic fluid doesn't really respond that way. So if anything, it tends to just cause kind of dehydration and stuff like that. So it's not a reasonable thing to trial early, but if it's not making a difference, I would just stop it. And then also infection is a high inflammatory state. So things like cellulitis, which is just a superficial infection of the skin, can actually kind of make things worse and progress it more. So there is also some risk if you have lymphedema of actually developing infection because that fluid that sits there is just kind of a more fertile ground for bacteria to grow in. And that can kind of spread pretty quickly and kind of get out of hand fast. So monitor the skin and also take infection seriously. If something's looking red, if it's looking hot, kind of angry on you, or getting some fevers, you should be reaching out to your doctor immediately to try to get on some antibiotics just so you can kind of catch that early before it turns into a bigger problem. So that's one thing I always say is really take that part seriously. Don't ignore that. And then I will pass it along to Lina. And then also my screen has Maddie Mills and I are in the same room, so she'll be coming on later. She is not Dr. Michael Fediw. She is Maddie Mills. She's wonderful. But we're on the same screen, so we'll see her later.
Thank you, Dr. Fediw. So the way that lymphedema typically presents is focally, kind of like what Dr. Fediw was saying, meaning that it will appear in an area which the lymphatic system was compromised. So this, therefore, would look different for someone with throat cancer, as an example, who may have swelling in their face or their neck, than for someone who had breast cancer, who may have swelling in their affected breast or arm or hand, than someone with prostate cancer who may have had swelling in their affected leg. Now, lymphedema would not show up in areas in which the lymphatic system was not compromised. So if someone, as an example, has leg swelling, but they had lymph nodes removed in their neck or in their breast, or if they feel that they have swelling kind of all over their body, it may be a different type of edema or swelling that it's not lymphedema, and it may be a good idea to ask your doctor about it. So for lymphedema, there are 4 stages. Stage 0 is that the lymphatic system has been compromised, whether it was from lymph node removal surgery or from radiation, but there isn't really any swelling that's apparent. Stage 1 is that there is swelling. It comes and goes. Maybe it's not there in the morning, and then as you go along your day, it starts to get worse and worse, and then you sleep and it goes away, or it starts to resolve with elevation. So that would be stage 1. Stage 2 is that swelling is consistently present. It doesn't really resolve with elevation. It doesn't really go away in the morning. It's just always there. And stage 3 is that the swelling is pretty significant and there are skin changes that are present, such as hyperkeratosis or discoloration, and some others. So if you are having any kind of swelling after your cancer treatment, please let your doctor know to get a lymphedema therapy evaluation. We have some great therapists at UT Southwestern that will help you with evaluating your lymphedema, establishing a home program in order to manage your swelling. We also see patients on a regular basis for complete decongestive therapy as needed in order to bring their swelling down. And we also follow up with patients who are at risk for lymphedema on a regular basis for screening, just to make sure that we're preventing lymphedema. So for complete decongestive therapy, this is the golden standard when it comes to lymphedema therapy. And it has 4 different components. So the first is a manual lymph drainage technique. So what this is basically a manual drainage technique that promotes the fluid, specifically the lymphatic fluid, to move in areas that we want. So moving out of the areas of swelling and into the lymphatic system so that it can be processed correctly. This is different than a lymphatic massage, as this is a targeted manual therapy treatment. The next component is a compression garment or bandaging. So compression can help with preventing the reaccumulation of fluid. The compression should be a medical grade compression, meaning that it is a specific level of compression. That way it will be able to prevent correctly the reaccumulation of fluid. Bandaging can also help, but usually we use bandaging for people who do have swelling. The next component is skincare. So we want to make sure that the skin, especially around the area of lymphedema, is nice and moisturized, because it does get drier when it is swollen. And if it's drier, it's more susceptible for infections. So your therapist will make the right recommendations regarding moisturizing the skin and protecting it from injury. And exercise, of course, is very important, like Dr. Fediw said. The muscle pumping technique can actually help with facilitating that lymphovenous return So it is super duper important to exercise, and your therapist can assist with developing a customized program to address your needs. So this is just a visual of the complete decongestive therapy program. Like I said, there were 4 different components. Next slide. So as Dr. Fediw mentioned, lymphedema is a chronic condition, but our goal is to help to maintain that lymphedema down. We want to bring it down and we want to keep it down, right? So those at risk may therefore be in 2 different phases, whether it's the intensive phase where our goal is to reduce the swelling. We will do this with the CBT and helping to initiate a home program. You can go back to that. But we basically are either in intensive phase where we're initiating a home program as well in order to help with making sure that it works for them. And once swelling is reduced or it plateaus, then you're in the maintenance phase where the goal is to keep that swelling down. We want to maintain that reduction. And that would be with the home program that we have prescribed, including compression or the manual lymph drainage, skincare, exercises, all of that. And then I'm going to hand it over to Madalyn.
So I'm going to talk a little bit about prevention. So we gave some general guidelines of compression that we'll go through. These are going to change based on the type of cancer you have and where the risk may be coming. So we do recommend for some of our patients that they wear compression garments to prevent swelling. So typically we recommend these when people fly in airplanes. Most people tend to fly in planes due to the pressure of the cabin, similar to what Dr. Fediw said. We recommend them during exercise like cardio or weight training, or strenuous activity, like if you're going to do any repetitive heavy lifting task at home. Like it's been said a couple times, we want you to exercise and stretch to whatever part of your body is at limb as once you're medically cleared to do so. The more we move our body, the more our body helps move fluid. We want you to do everyday activities. So if your arm is at risk, we don't want you to go home and pretend it doesn't work or baby it or protect it. The more, again, we want functional movement. We want you to move your muscles. For people who participate in our prehab classes or who have baseline measurements, we do screening about every 3 to 6 months for 18 months after treatment. Across the board, across variety of cancers, what we see is like that first 18 to 24 months is when the vast majority of people do develop swelling. That's when we screen the heaviest for it. You can, of course, develop it later, but that's kind of when we see the bulk of people developing it. We'll want you to just be vigilant about your body, keeping out an eye out for early signs and symptoms of swelling, which we will talk about. As Dr. Fediw mentioned, the sooner we treat swelling, the less likely it is to be a cumbersome chronic problem that you have to face. If you get any cuts or scrapes, we want you to keep them clean and covered until they're fully healed. That's just general infection prevention and hopefully something that we're all doing already. We want you, when you're getting back into exercise, you want to resume gradually. So we want you to kind of gradually go up in weight, gradually go up in reps, gradually go up in intensity. We don't want to go from not doing any exercise at all during our treatment phase to doing really intense exercise without that gradual buildup. We want to avoid deep tissue massages just in the area that's at risk. You can have light or medium pressure in those areas, but we don't want them doing really deep work. And then we want you to be mindful about exposure to excessive heat outside of living in the South. Hot tubs, saunas, hot packs. If we can keep the parts of our body that are likely to swell away from hot, moist heat, it can be helpful in preventing fullness. So some early signs and symptoms of swelling. So the area feeling heavy or achy, like it's tired or bruised. Sometimes we can feel excessive fluid in a limb before we can see it. You can feel the weight of that collecting in your tissues. If you notice swelling that comes and goes or responds well to elevation, if your hand or foot is a little bit puffy, but you elevate it and it goes away and it feels good for a couple days, but a couple days later it comes back, that intermittent swelling we want to pay attention to. You want to pay attention to your jewelry or clothing being really tight at your wrist or at your ankle. That's a pretty good judge of what's going on in those limbs. And then any swelling that lasts longer than about 6 weeks after surgery. We expect everyone to have swelling immediately after surgery. It's normal to have post-op swelling. We would expect that to, as long as you're healing normally, to gradually get better over that first initial 6 weeks. But you're not gonna wake up with post-op swelling that's immediately gonna be lymphatic in nature. If you feel like you are having signs and symptoms of early swelling, or it's been more than 6 weeks in surgery and you think maybe you need to see a therapist, we do recommend reaching out to your provider to get a lymphedema referral. If you're at UT Southwestern, all of our lymphedema therapists are going to be certified lymphedema therapists. If you're going outside of UT Southwestern, we strongly recommend that you make sure whoever you're being referred to does have that certified lymphedema therapist title. That CLT should be in their alphabet soup after their name. That's how you know that they have done all the training and that they're really going to be able to give you a comprehensive program to follow up with. And then so here, UT Southwestern does offer prehab classes for a lot of our different cancer patients. So Lina and I actually run the breast cancer prehab class. We try and meet with as many of our breast cancer surgical patients who are appropriate as possible, either right before or right after surgery. So we kind of reach out for that. We do a bone marrow transplant prehab session in our cancer rehab department. Our physical therapists are in charge of that. Our physical therapists also meet with our GI cancer patients and our CAR T patients to do some prehab. And then there's head and neck modules that are upcoming with the head and neck department. So in these sessions, we would take baseline measurements. We may be doing baseline measurements for possible swelling. We may also be doing baseline measurements of your movement and your strength and your endurance. All to kind of help maximize functional outcomes. We also provide education on exercises and prevention of swelling. If you feel like you don't have any swelling and you would like to meet with a therapist to go over some prehab, you can get a referral for that, even if you're not someone who's like in a cancer program that has a dedicated prehab class. We can do that on a one-on-one individual basis and kind of talk specifically about risk and ways that we can kind of mitigate that. Okay, and then the last thing I'm going to talk about is just lymphedema treatment by stages. So Lina went through all the different stages. So we're just going to talk about what it would look like if you were seeing one of us and you were in any of those stages. So remember, stage 0, we don't necessarily have any visible swelling. We just have impaired lymphatics. So this is when we're doing a lot of our prehab work. This is where we're getting baseline measurements. We're doing education. We're just kind of screening at this point. For people who are getting into stage 1 swelling, you might end up working with a CLT on a regular basis for a couple of weeks, or if it's really minimal swelling, you might end up doing compression on a daily basis for a couple of weeks and then having some new measurements taken and seeing how that goes. Compression is actually very effective in addressing very early swelling without needing other interventions. Wearing compression on a daily basis can do that for you. If you're in stage 2 or 3, stage 2, you're certainly going to be seeing a certified lymphedema therapist on a regular basis. We'll be doing manual drainage. We'll either be doing compression garments or compression bandaging and getting a really good home program established for you. And then in stage 3, we would certainly be doing the bandaging and the manual drainage. If you're in stage 3, you might see as more than on a weekly basis. You might see as twice a week or 3 times a week, depending on the severity of the swelling. So just kind of a little rundown of what that would look like. And I think, yeah, that's it for us. Oh, I can't go back. And I know Alex is going to lead us in our Q&A.
Awesome. Thank you guys so much. And we have a great list of questions and some more coming in the chat. So also encourage you to take a minute if you have questions to add those, and we will try to get to as many as we can. So the first question, and I think it's kind of a broader conversation piece, is managing lymphedema long-term. So if this, as you mentioned, Dr. Fediw, isn't something that we heal, but that we manage over long-term, what does that look like for someone who's several years out? What could they be doing to mitigate as much lymphedema recurrence as they can?
Sure. So it's a really good question. So like I mentioned before, it's a chronic thing. So even if you're many years out, it also can develop later on, especially if you've had a history of radiation. So sometimes, you don't have lymphedema for several years and then you do. That always requires an evaluation by a doctor. to make sure that it's not some other cause that's contributing. But if it's just the lymphatics from some of the kind of chronic damage to the lymphatic vessels or the nodes, then at that point you can see a lymphedema therapist. If you've never seen a lymphedema therapist, you have to. I'll just put it that way. I can't reiterate enough that if they're not a CLT, as a lymphedema expert myself, I don't consider your lymphedema as being treated. Sometimes people be like, well, I have this really great massage therapist and she's really wonderful and she really helps me a lot and she got some training to do lymphatic massage. That's not enough. That's not comprehensive lymphedema management. It's not enough. If you're like, I saw a chiropractor and he did this course and he had some special training there, I did it. That's not enough. If you haven't seen a certified lymphedema therapist, it's not treated. That should be step one. The goal is for this to always be a home program. So something that you can manage on your own. My whole practice focus for lymphedema and every other diagnosis I treat is for you to be able, hopefully, to just go out and live your life and do the things that are meaningful to you and connect to the world around you in the way that you want to. So I try to make everything, the goal, if it's feasible, is to make this a home program that you are able to do on your own. Now, sometimes people still need refreshers. Something happens, they get infection, they get a hospitalization, something changes. They just kind of get a little more swollen. It's totally fine to go back and do like refresher courses. If it's been a while and you haven't seen a certified lymphedema therapist in a while and you might need some wrapping or some, somebody else to do kind of a little bit more fine-tuned work on you. That's totally fine. But the main thing is it's designed to be a home program. So you have to keep the fluid moving. That's usually through the manual lymphatic drainage, which we can teach you how to do that yourself. There's also lymphedema pumps. If you see us, we'll work on helping you get all of these things. So that's not all stuff you got to go find on your own. Come to us. We will get you set up the right way and get you set up for success. But you do have to keep the fluid moving, and then you have to wear your compression. It's not lost on me that we live in Texas. Texas is hot. If I had a cooler answer that said you got to wear your compression in the middle of the summer, I would give it to you, but I don't. So you have to wear compression. I've seen the people where we try to get around it and then they tend to come back later and their swelling's worse. That's what we don't want. So it's a long-term thing, but we're here to help and we're here to make it as easy on you as we possibly can, but we want you moving forward with the right information. So now have a place and you know exactly where to go. If you have issues, come talk to us.
To continue with the idea of a home managed program, there's some questions about things like nutrition and sleep. How do those play a part in maybe reducing the amount of swelling you might get?
Sure. So I don't think there's any evidence that suggests that if you're not sleeping well, you're going to develop lymphedema. However, if you have lymphedema, there are factors that can contribute in general to the fullness of your swelling. There's no specific lymphatic diet. There are people describing things out there, but nothing that has really concrete research behind it. Limiting things like salt intake. So salt really doesn't affect your lymphatics as much, but it does contribute to your body. Salt attracts water in your body. So when you have high levels of salt in your blood, it wants to pull water in and it kind of increases the overall pressure amount of just fluid in your body in general, which if you have lymphedema, it might make it a little more full. Other things like, people have talked about anti-inflammatory diets and things like that. They're all reasonable things to do, but they're going to be something that is in addition to maybe control your overall amount of swelling. It's not going to be the difference between if you have lymphedema or you don't have lymphedema. So eating generally a balanced diet, something that's high in protein, fiber can be helpful because it can decrease certain circulating things in your blood that can contribute. But in general, there's not a specific diet. I would just say in general, what we call a heart healthy diet would, I think, be suffice.
What about sleeping positions? Is it recommended to elevate, to do anything to reduce swelling that may happen overnight?
Good question. So early on, we talked about the staging of lymphedema. Early lymphedema responds to elevation. So when you raise your arm or your leg, it allows that fluid to drain off. Later stages, once you're in a stage 2, stage 3, those kind of things, it does not respond to elevation. So I keep it pretty simple. I say, if you bring your limb up and your swelling reduces, keep doing it. If not, don't worry about it. That fluid doesn't know where to go, and that just the gravity isn't getting it there. So in that case, you have to just keep up with moving it yourself.
And you don't need to sleep with elevation for prevention.
Correct.
Like
Yes.
just getting in, like when you're sleeping in a bed, you're in gravity neutral, you're already giving your body a break. So you don't need to elevate just to prevent.
Awesome, thank you. Lots of questions about the machines that are involved in lymphedema care. Can you guys talk about what the machines do, access to those machines,
Yeah.
any information about insurance, that kind of thing?
Absolutely. So I'll keep it pretty short and sweet. So there are lymphatic pumps. So it's a pneumatic compression device. What that means is it's a device that if you have an arm, it's a sleeve. It's kind of a little bit of a big bulky thing, but you put it onto your arm. There can also be chest or abdominal attachments, depending if you have some swelling in, say, like your armpit or your chest wall area. But it really depends on some of the specifics of your swelling, what your history is. But the long short of it is it has different chambers in it. So think of like a sleeve with a bunch of different pockets in it that it fills with air. And that creates compression of different levels, and they inflate and deflate the different chambers differently at different points, and it kind of squeezes that fluid along. So they're a good treatment. They can be very effective. They're more passive. So basically, you say if it's your arm, you put your arm in this sleeve, it's connected to this machine, you hit a button, and it just starts doing its thing. It feels kind of nice. It's like getting a massage, but it's very passive. So you read a book, you watch TV. Usually it lasts about 60 minutes, I would say on average. Sometimes there's kind of different protocols that are there, but 30 to 60 minutes usually a day is what's required. And it's usually something you have to do consistently. It kind of takes the place of some of that massage, although not always. Sometimes you do have to do both. It just depends on some of the specifics of the swelling that you have. Insurance does cover them. It depends on the insurance. So certain insurance will cover them 100%. Certain, like Medicare, for instance, will cover 80%, whatever 20% is left over. That will either, if you have a supplement, that can cover it, or it might be out of pocket. There are some financial assistance programs through some of the companies, particularly if you have a certain income and you just can't afford it, and there is an out-of-pocket cost. If you meet certain parameters, they will help you get the pump. And there's also some organizations out there that help. So what you should be doing, though, just come to us and we'll do all this for you.
And also a lot of insurance actually requires therapy notes to justify a pump. So like if you don't have documentation from a provider that you're doing that conservative work, you will not get it covered. So just know, like, if you're trying to kind of jump the system, like starting at the front, a lot of times they're going to come back and ask you for a therapy note, and then you're going to be backtracking. So it is easier if you come and let us work the process the way it's intended to be.
Yeah, there's very, very specific documentation involved with that, including with the sleeves. So different sleeves, they're not all created equal. Different stockings, they're not all created equal. And we know the lingo. So that also justifies what we know you need, and also creates less friction and less pushback on actually getting these things covered and actually allowing you to obtain them. We try to work pretty hard to make your lives easier. I'll put it that way. And we do take that seriously because y'all are dealing with enough. So we want this it's already inconvenient. We want to make it as no more than it has to be. So yeah. And they usually require at least 2 different measurements of your limb while you're doing therapy. At least different insurance require different things, but usually it's at least 30 days apart. So I would agree with you can't skip the line. You kind of just got to do the program, but that's actually the best way to do it. That's actually how you treat it. You don't want to try to cut corners too much with lymphedema. There's a very specific way to treat it, and you got to kind of just do it that way.
Great question in the chat about the correlation between lymphedema and neuropathy. How, if at all, are those two things connected?
They are not.
Okay.
I'll just say that. I will say this, though. I have patients, and like I said, if you're having issues, this is why we have a lot of expertise here that you won't find in a lot of places. So I do have patients that sometimes neuropathy, people describe it a lot of different ways. And there's a classic kind of medical way you hear it described where might be tingly or burning, or might just feel numb. Sometimes that's the case. Sometimes it can actually feel like a tightness, like a swelling. So I've had patients where they come to me for a lymphedema evaluation, and I'm looking at their limbs and they don't really have swelling. But they're like, no, no, no. And they'll show me pictures where they have like socks on or something, and it'll be like a faint line or something like that. And we get testing. The testing's negative for the lymphatic system, but they also have like some numbness stuff like that. And I'm like, you really just have neuropathy. And we treat their neuropathy, and that tightness and the swelling goes away. You know, in reality, it was all the neuropathy. So sometimes it can be kind of a mimic, but that's why you kind of need evaluation from people that understand both. I also treat neuropathy, so I understand both of those processes. And we also want to make sure that you're guiding the right way, because in those cases, I get to be like, I got great news. You don't have lymphedema. You don't have to do all these other things, and you don't have to wear your, sleeves and stockings in the Texas heat and stuff, but you do have this other thing, and we can, we'll walk down that treatment.
Lots of questions about sleeves, including can we wear compression sleeves at night? Is that recommended? Guidelines on flights. Are there longer flights that someone should avoid at certain times in their lymphedema care? General guidelines that you might offer, also knowing that it is very dependent on the patient.
Generally speaking, compression is going to be worn during the day and removed at night. The only exception to that is going to be if you are flying. So if you're flying on a red eye, you're flying overseas, your compression is going to stay on all the time on the plane. The general guidelines that we kind of follow for plane travels is that you want to wear your sleeve an hour before your flight through an hour after your flight. You can have it on longer if it takes longer to get off the plane and get your luggage. It's not like you have to take it off, but that's kind of a good ballpark. As far as length of flight, I have not heard any guidelines that you should avoid a certain length of flight. So please feel free to travel and enjoy the world.
Right. Could you speak a little bit more about lymphedema massage? What is involved in the technique? How effective is it post mastectomy was the question, but post surgery? Can you go through some of the more specifics on that treatment?
Sure. So manual lymphatic drainage is going to be like a mild to medium pressure, and it's designed to kind of increase lymphatic flow. So we're trying to kind of increase that and increase the efficiency of your body of moving your lymphatics around areas of damage. It is effective when it is done how it is designed to be done. So like when you've learned it from a CLT and you're getting a good formal program. And when you're doing it consistently, those are really big things. You also have to pair it with compression. So you can't do like part of the program and see results. Like I only do manual drainage, but I hate my garments. Like that they go together, they work together as part, it's a full program. So if you're only picking and choosing parts of the program, you're not going to see the same results as someone who's being very compliant with the whole program. Yeah, I don't know if I have any other.
Yeah, I wouldn't. The rest of the specifics are, if you have it, that's more of like a personal treatment that, we'll teach you all that stuff.
Okay.
They're excellent questions, because this is why, a lot of people are reasonable. They get on the internet and they try to figure out ways to kind of self-treat their problem. But this is why I always reiterate, you have to do kind of the whole thing. It's not just kind of pick and choose. Also, there are other times where they're like, oh, I got this swelling, I should go see, lymphedema therapist, when that swelling could be something completely different. Something that's more concerning, blood clot in your arm or other things that, you wouldn't actually want to be doing some massage. You would want to be treating the clot. So that's where a lot of times medical evaluation is also warranted.
How about kind of prevalence or who might be more at risk for getting lymphedema? So questions about if I have an autoimmune disease, individuals of certain ethnicity, are there risk factors that make someone more at risk for lymphedema than just the surgery in and of itself?
Yeah, so that slide I put on earlier about, so obesity is one, the more extensive, basically the more extensive your surgical procedure, the more complications you have from your surgical procedure, how many lymph nodes were removed, if any, and whether you had radiation, are all risk factors, individual risk factors for, developing lymphedema. That being said, just because you had, say like a lumpectomy and just one lymph node biopsy and you did radiation or anything, doesn't mean you won't get lymphedema. And just because you had all those things doesn't mean you're guaranteed to. It's just statistically, you're more or less likely to. Now, as far as ethnicities, there has been some study there. So we don't have a huge body of evidence, but it does seem that African American patients tend to have a higher risk of breast cancer related lymphedema. There is some things that could suggest Hispanic origin could also be a risk factor, but it was a really, really small sample size, so it's really hard to really make a concrete connection there. But I would say all those things might increase your risk more, but it still doesn't mean you're going to get it. And usually it's not isolated by itself. It's in conjunction with getting the mastectomy and getting the other things. There also is some risk of bias in those studies, just based off different factors about how the patients present and also some of their access things. So, there are other health disparities that I think could be contributing to that. So I would say we don't know concretely, but it does seem at this point that there's probably an increased risk in African American patients.
So another awesome question that fits our academic institution, and that's, what is being done in the world of research on lymphedema? There's some notes in here about, will this be treatable with a pill? Are there surgical techniques that are being refined that may reduce lymphedema? And what is UT Southwestern currently researching in the area of lymphedema?
Good question. So in the lymphatic world, right now we don't have a pill, unfortunately. There has been some look into some dietary supplements in like animal models. It's all very hypothetical. It's stuff we don't know if it's real or not at this point in time. They are doing kind of ongoing research on different like surgical techniques. One thing that does decrease your risk is if you have breast cancer, specifically, I know I keep saying breast cancer. There are a lot of other types of, things that get lymphedema, but we do know in breast cancer, if you get what's called immediate lymphatic reconstruction at the time of your mastectomy, it significantly reduces your risk of developing lymphedema by close to 25 to 30%. So it's not insignificant. But some of that depends on your institution and what kind of access they have to that. We currently have a surgeon doing that. And we want to expand that program if we can. And there are most of it that I've seen right now is in that or ways to reduce it from different like radiation techniques and stuff. Here at UT Southwestern, more of our research currently has been in the actual imaging of the lymphatics and are there better ways to kind of capture the function of the lymphatics radiographically. So with things like MRIs and stuff like that. And that's kind of where we're at now.
There's a question about the Lymphedema Act. Can you speak about the extent of what the act does cover?
Yeah, excellent question. So really grateful for that. Joe Biden was actually involved in that because I have a colleague down in San Antonio who is also pretty influential, and also somebody over at in Georgetown in Washington, D.C. that was pretty influential in that act. So it basically is an act that was passed by Congress that improves coverage of lymphatic garments. So if anybody on this call has lymphedema, the garment, especially if you get a custom garment, can be very expensive, and insurance used to just be horrible at covering it unless you had really, 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 really good insurance. And we've been kind of advocating for a long time now, saying this isn't okay. This is something that you need to take seriously. And it took a long time, but we are now at a place where they listen to us, and now insurers, Medicare, even some of the Advantage plans, a lot of the private insurers are covering lymphatic garments, and it has been much, much less troublesome than it used to be. So that act got passed about 2 years ago and went into effect last year.
All right, I think that was the last question. I know you guys had a chance to look at them. If there are any that you wanted to make sure we addressed that I skipped over, please let me know.
I know I've seen one pop up twice about patients under 18. I think our cutoff is 16. I think if you have a patient who is not able to get services at Children's, you would need to kind of get in touch with one of us and we can find out for treatment services, like there's some restrictions when we have minors in the building. So for whoever that is, like, I don't know, did our emails go out with any of this, Alex?
I don't believe your direct emails go out. They do get a copy of the presentation. So that question came up. You'll receive a recording.
Okay.
And I believe your names and contact info are on those slides. So
Okay, yeah. So if you want to, if you guys have minors who need, like, we can't do small children, we don't do little kids, they have to be teenagers. There's some rules about all of that, but we can ask for permission for that if there is a need.
We don't have an obvious route for that, but we are more than willing to help. So we're here. So if there's ever a question, talk to your pediatrician, say, hey, there's a lymphedema program at UT Southwestern or through the Cancer Center. Can you please reach out to them or send them a referral, and we'll try to troubleshoot it as best we can and work with them as best we can. So we're more than happy to help and get you what you need.
There was one about elevation. I would say, like, clinically, we see some people need a sleeve when they're at elevation, like in Colorado in the mountains, and some people don't. That's a lot of times going to be how you personally respond to elevation. I think it would be a good idea to have your sleeve with you and to wear it during the day if you feel like you need it. But that's people tend to respond to elevation differently depending on how their bodies respond to elevation. So there's not like a super clear-cut answer on that.
There was a question about lipedema. We do understand that. It's kind of outside of the scope of the talk today. Lipedema is a different thing, although there is a lymphatic component to it. So not something we'll talk about today, but if you have questions about lipedema, that's something we treat and can come talk to us about it.
I think we have covered the majority throughout the presentation and our Q&A. So thank you, all three of you, very much for spending your lunch hour with us. Really appreciate your time. Again, you will get a recording, a copy of the link to the recording probably next week. So keep an eye out for that. You'll also hear about our upcoming Lunch and Learn series. Those are still being finalized for the summer, but you'll soon get the schedule coming out for the next topics that you can attend. So thank you again, Maddie, Lina, Dr. Fediw. Really appreciate all three of you for joining us.